Rising monkeypox cases causing some concern. Here in Michigan, the State Health and Human Services is reporting 37 cases. WXYZ has received many questions from viewers about the virus, and hopefully we can provide some answers today with our Chief Health Editor, Dr. Partha Nandi. And Dr. Nandi, the first question is about the risk of contracting monkeypox in close contact sports as we get ready to head back to school. Jane Allman wrote in her high school graduation about her grandson who's a wrestler. She wrote into that. What do you have to say to Jane and other parents?
Yeah, I'm a parent myself, as you know, Glenda, and I can understand the concern. Now, wrestling, we all know, is a close contact sport, and the primary way monkeypox is spread is through close contact. People can get infected through physical contact with rash, scabs, or lesions that can develop anywhere on the body or through bodily fluids like saliva. Infections can also happen through respiratory particles during prolonged face-to-face contact, or if someone touches contaminated items like clothing or towels. As for how much danger there is for student wrestlers and the general public of contracting monkeypox, right now it's believed to be low according to the CDC, and we'll keep this up, because it'll change over time. But those most at risk are men who have sexual contact with other men. Having said that, I think it can't hurt to take precautions. So my advice, try to avoid contact with any rash that looks like it might be monkeypox. Don't take a chance. Don't share items like water bottles, eating utensils, or towels. Wash your hands regularly with soap and water, especially before eating or touching your face. Alcohol-based hand sanitizer also works well. And also know how much spread there is in your community by keeping an eye on the CDC's map.
So that's some great advice, Doc. We appreciate it. We have another question that's coming in from Donna Hitpus, and she's asking what treatment is available for monkeypox.
So Donna, there are no specific treatments for monkeypox infections. However, monkeypox and smallpox are similar viruses, so antivirals used for smallpox, such as tecovirimat or TPOXX, can be prescribed. And they're usually recommended only for severe cases like patients with a body-wide rash and a high risk for complications from monkeypox. For the most part, however, treatment involves managing symptoms while isolating at home. Now, painkillers and sitz baths can help to relieve pain and itchiness as well.
So we got another question, last one today, from Creasy Satney, who's asking if monkeypox can be deadly, Doc.
That's a big question I get from many of my patients. So the monkeypox virus can be fatal. Now, most deaths have been in Africa, but there have been 4 reported outside Africa in India, Spain, and Brazil. The CDC recommends around 99% of infected patients will likely survive, so that's great news. Those most at risk are people with weakened immune systems, kids under 8 years of age, and women who are pregnant or breastfeeding. Now, if your loved one falls in any of those high-risk categories, I would recommend speaking to your doctor about a vaccine, and definitely take precautions to avoid the viruses. A lot of my patients are asking me, and our viewers too, so please keep them coming, and then we'll keep you updated as the status changes.
All right, Doc, we appreciate your time and expertise always. Thank you for joining us.
My pleasure.